as we're moving forward in Chapter 3, we're really focusing on how complex healthcare actually is and looking at ways that we can actually integrate and collaborate to elevate the care delivery and the outcomes for those that we serve. So, when we're looking at interprofessional teams, they're invaluable. Think about care coordination and how important it is so that there's a continuity of care and effective communication between all those who are involved with care delivery for particular individuals, patients, populations. We really need to work together to elevate the outcomes, because very often we've often used the term silo, and the different disciplines are within their own silo, and many times there's duplication or miscommunication, or maybe going in two different directions that may not be for the greatest benefit of those that we serve, whatever it would be, whether it would be population or individuals. So what we're really looking at is working smart and effectively. So no individual discipline can really meet the healthcare needs of those that we serve or an organization. So think about the big picture and how we all need to work together. And this was actually demonstrated pretty clearly in the Future of Nursing report by the Institute of Medicine, that they're really putting nursing, and we should embrace this, at the forefront as far as developing those interprofessional teams and looking at care coordination and care collaboration. So in order to actually engage different disciplines and different organizations even, the leaders really need to focus on key skills of building those relationships, building those bridges between those different disciplines or different organizations. So some of the key skills that are highlighted in Chapter 3 include listening, emotional intelligence, and embracing change leadership. And we touched on change leadership in Chapter 2, so we're bringing that forward and really looking at applying those skills as we're building those interprofessional teams or interdisciplinary teams, or even interorganizational partnerships that we need to develop to actually improve health outcomes, and also to really start to address some of the issues that we're experiencing in healthcare as far as duplication and elevated costs, and really looking at ways to be more effective in the care that we deliver. So just kind of recapping, we really need to focus on communication, we need to focus on relationships, and providing a voice to all of those pieces of the puzzle that may not be typically healthcare providers, but there are many pieces in the puzzle, especially when you're looking at social determinants of health and population health, that actually play a very important role in the experience of health. So we not only need to look at healthcare and the professions within healthcare, but we need to look outside the box a little bit and look at things like education, even safety-related issues, police, law enforcement, emergency preparedness, building those resiliency skills to adequately prepare those that we serve to fare better in long-term outcomes, especially when we're faced with many of the disasters that occur throughout the world. So when we're looking at Chapter 3, think about the nurse's role in developing those relationships and building that interdisciplinary team and building those inter-organizational teams to affect better outcomes for those that we serve. So if you have any questions, feel free to let me know. I look forward to our discussions in our discussion board and looking at some of the case studies. So take care and let me know if you need anything. Thanks so much.